Hello, I'm Dr. Jack Wolfson, board certified cardiologist, and welcome to my presentation called AFib Supernutrient. I'm natural heart doctor again, Dr. Jack Wolfson, board certified cardiologist, and I want to ask you a question. What if there was an all-natural nutritional supplement for people with atrial fibrillation that lowers atrial fibrillation burden, or the amount of AFib that you actually get, was also a natural blood thinner, and helps to slow down heart rate if you're in atrial fibrillation? The good news is there is this particular nutritional supplement, and I'm going to tell you about it in a second. I'm a board certified cardiologist and general internist. I'm a former senior partner in Arizona's largest cardiology group. I was the director of cardiac rehab, chairman of medicine, director of cardiology. In 2011, I was voted Phoenix, Arizona's top doc in cardiology. In 2012, I started the doctorswolfson.com and Wolfson Integrative Cardiology, where people from all over the world come to see me for the best in heart health. I was voted top MD by Natural Awakenings magazine and recognized as one of the top 50 functional medicine doctors back in 2018. I'm also a widely acclaimed international speaker, and I have a book called The Paleo Cardiologist, The Natural Way to Heart Health. You can grab a copy for free at freeheartbook.com. I want to tell you about this super nutrient, and this is called berberine. Now, berberine has been studied by the Chinese for 75 years. It's all natural, and it comes from the barberry tree. And they distill out this molecule called berberine, and it has some magical benefits for everybody, but especially people with atrial fibrillation. Now, I want to remind you that this video is for information only. This is not medical advice. Please talk to your doctor before making any changes in your healthcare plan, and do not stop any pharmaceuticals until you discuss with your doctor. So, the National Library of Medicine has a website where you can go and look up any study that's ever been done. So that website's called pubmed.gov, and I spend a lot of time on there doing research. And if you go in there and punch up the word berberine, the supplement that we're talking about in this presentation, you get almost 2,000 results about that one nutrient. So a lot of information has been published about berberine. And when you look at all the things that berberine is proven to do, as far as improving cholesterol numbers, lowering inflammation, oxidative stress, improving blood pressure, helps with people with heart failure, and also atrial fibrillation. Now, I just want to show you some more cool stuff about berberine before I dive into the actual AFib info. So it is a well-known immune booster. It is a virus fighter, a bacteria fighter, antifungal. It's antiparasitic. A lot of different studies. Look at this. 864 studies show how berberine goes after cancer cells. Very cool information there. Better brain, improves depression, anxiety, anti-aging, and is phenomenal for blood sugar reduction. In fact, compares exact to metformin, one of the biggest drugs by prescription in the world. So berberine is absolutely fantastic, and even helps with weight loss. So let's talk about berberine and atrial fibrillation. I think you're really going to appreciate this info here. So this is from 2015, effect of berberine on the rabbit model, where they're able to take rabbits and put them into atrial fibrillation, and berberine helped to prevent that. There was a study done all the way back in 1992 about how berberine works as an antiarrhythmic for people. Undoubtedly, this will benefit their atrial fibrillation and maybe other heart rhythm problems as well. Back in 1994, they looked at 28 patients with PVCs, ventricular premature complexes, and they put them on berberine, and they saw marked improvement in the amount of PVCs. And then the question was asked in 2017 about berberine and AFib, and what they found is that it's actually very effective for atrial fibrillation. And what they did is they took a group of people, and half of the group got berberine, the other half got amiodarone, one of the most powerful atrial fibrillation medicines in the world, but also very toxic as far as the damage it can do to thyroid, liver, lungs, and just overall, even in your eyes, it really has to be closely monitored. Amiodarone is, again, well known to be very toxic. So what they did is they looked at 45 people in each group, and the group that got berberine, 1.5 grams was the dose of that. There were no significant side effects reported at 1 year, and they were monitored for 1 year. So check this out, berberine versus amiodarone. You will see that on the left, what they're looking at there is percent conversion to normal sinus rhythm. So the higher you are on this chart, the better off you are, as they look at them for 12 months. And you will see the berberine group actually did better than the amiodarone group. Very, very impressive data. It's not that often that things are compared directly to pharmaceuticals compared to nutraceuticals, where they compare the two. And in this case, berberine beats it. So berberine does as well or better than metformin. Berberine is fantastic, again, for finding your perfect cholesterol and lipid numbers. And it turns out berberine is just as effective as amiodarone without the toxicity. So this is the product that we carry. It's called Berbe. It's 500 milligrams per capsule of berberine. There's 120 caps in our bottle of Berbe. And our product is tested for metals, it's tested for impurities, it's tested for mold mycotoxins, and we have it manufactured by one of the best companies in the world in business for over 40 years and meets our specifications. Now, berberine is fantastic for rhythm control, but it's also one of the components of rate control. So to keep your heart rate under control if you go into atrial fibrillation. Other things that help in this, what's called acetylcholinesterase inhibition. So you have a lot of acetylcholine to help slow down the heart, berberine, curcumin, ginger, green tea extract. So what we did is that we found out that when we looked at the nutrients inside of our optilipid, it turns out optilipid is also perfect for atrial fibrillation patients. So I recommend everybody to get on both of these products. Here's the recommendation for berberine, celamarin, green tea, curcumin, resveratrol, ginger. It's all inside of there. And you can see we're not using any kind of nasty fillers, just basically triglycerides from MCT oil and silica, which most people are deficient in anyways, which is great for hair, skin, and nails. And this is the AFib natural protocol, 1 cap of Berbe and 1 cap of optilipid 2 times per day with food. So what that'll do is it'll get you to 1,500 milligrams of berberine, which is the study dosing, plus you get the benefit of the 5 other nutrients that are inside of optilipid, and it's great for your lipids. So you're going to get so many benefits of this, but specifically we're looking at atrial fibrillation. Now, I want you to check with your doctor if you are on rhythm control drugs like sotalol, amiodarone, or flecainide, because if you are looking to stop those and start this natural product, you can. You just got to work through the doctor first and make sure it's okay. You don't want to take these in combination with those rhythm control drugs. If you were to take them in combination, the QT interval of the EKG has to be monitored. So those are the kind of things you want to tell your doctor. But it's very easy to take these products for anybody and everybody if you're not on these rhythm control drugs. If you are, then again, check with your doctor and make sure it's right for you. Here's what the protocol is. 1 cap of Berbe, 1 cap of optilipid 2 times per day with food. And the side effects, if anything, are very minimal, maybe a little stomach upset, rarely in people, but generally most people tolerate this very, very, very well. And they do so naturally without those nasty drugs, amiodarone, sotalol, flecainide. We can do it all naturally. So that is my presentation about berberine and some other nutrients to help you with your AFib and stay in normal sinus rhythm. Thank you.